Hi, my name is Rachel. I wanted to take a few minutes and review some important post-op instructions. At the end of your visit in our office, you'll receive a helpful post-op booklet that outlines all of the information included in this video, so no need to take notes. The extraction of teeth is a serious procedure, and following your post-operative care instructions is very important to prevent complications, unnecessary pain, discomfort, and additional expense. Let's get started with some basic care instructions. Do not rinse your mouth or brush your teeth until the morning after surgery. The day after surgery, you can use a solution of half a teaspoon of salt and a glass of warm water to rinse your mouth as needed. Remember not to swish too vigorously, since this could dislodge the blood clot and delay healing. To promote healing, you can begin brushing the tissues of the extraction site 1 week after surgery. Your stitches will dissolve on their own in 5 to 10 days. Following oral surgery, spotted bleeding is not uncommon for the first few days, especially when you brush or rinse. Simply place a roll of gauze over the wound and bite down firmly, and be sure to change every 30 minutes until the bleeding stops. Do not spit or rinse, as this can make the bleeding worse. Simply swallow normally. If bleeding continues, try biting on a moistened tea bag for 20 minutes. The tannic acid in the tea bag helps form a clot by contracting the blood vessels. It's also a good idea to lie down with your head elevated on 3 pillows. Please call the office if the bleeding appears to be brisk or pumping. It's important to prevent dehydration when having oral surgery, especially since your solid food intake is limited immediately following your procedure. Increasing your fluid intake to at least 5 to 6 glasses of water or other clear liquid will help. We suggest eating yogurt, pudding, jello, instant breakfast shakes, milk, ice cream, and applesauce on the day of your surgery. The day after surgery, your diet should consist of soft foods like soup, eggs, cottage cheese, pasta, or even a hamburger patty. Staying comfortable is important as you recover after oral surgery. For severe pain, please take the medication prescribed to you. The pain medication will make you a little groggy and will likely slow down your reflexes. Do not drive or work around machinery, and be sure to move about slowly. Suddenly standing from a lying position can make you dizzy. To manage moderate pain, please take 800 milligrams of ibuprofen or 500 milligrams of Tylenol 3 times a day with food. Pain typically peaks around day 3 or 4, then gradually subsides over the next 1 to 2 weeks. If you have been given a prescription for an antibiotic, take the entire prescription as directed. The drugs you may have been given will help minimize swelling, reduce discomfort, prevent infection, and promote healing. Discontinue your medication only in the event of a rash or other unfavorable reaction, then call our office immediately. It is important to note that antibiotics may reduce the effectiveness of birth control pills, so you should use backup birth control until you start your next pack of pills. Swelling and discoloration are normal responses following surgery, but can be partially avoided by using ice packs for the first 72 hours after surgery. You should put ice packs on for 20 minutes and take them off for 20 minutes as much as possible. Maximum swelling normally occurs around the 3rd day following surgery. Warm moist heat should be started following the 3rd day and be continued until the swelling is down. Jaw stretches are recommended at this point, normally around day 3. To perform, you want to open your mouth as wide as you can, then close and repeat for a few minutes. These exercises should be done several times a day until the jaw returns to normal. You may also develop black, blue, or yellow bruising in the tissue. This is due to a slight collection of blood beneath the tissue and is perfectly normal. A slight fever can also be expected after surgery and is normal. It's important to keep something light in your stomach to help with nausea caused by taking pain medicine. Try not to get up and move around more than necessary, and please call our office if nausea persists. Difficulty in opening your mouth due to muscle spasms is not uncommon with removal of impacted or buried teeth. If a lower impaction was removed, you may have numbness of the lower lip or tongue on the side where the tooth was removed. This is almost always a temporary condition, but it can be annoying. It can last anywhere from a few days to several months. Sores can develop at the corner of the mouth, and these should be covered with a mild ointment like Vaseline. Occasionally, patients will place their tongues on an operation site and feel a hard substance, which they think is part of a tooth. It is not the tooth. It is a hard bony wall that originally supported the tooth. Simply leaving it alone and it should heal on its own. Please note that it will take approximately 4 to 6 weeks for the extraction sites to fill in with bone, depending on your age. A dry socket is a defective, abnormal healing, most common in the lower molar extraction sites. When a tooth is removed, the empty pocket fills with blood. This blood is critical to the future permanent tissue that will eventually fill the socket. The pain experienced with a dry socket is caused by exposed bone that is not covered by a blood clot or new tissue. A dry socket can occur somewhere between 5 to 7 days following the extraction. The two most common signs of a dry socket are pain in the jaw that radiates into the ear and a foul taste or odor from the extraction site. A dry socket is not an infection or an ear problem. It has been shown that cigarette smoking can increase the incidence of dry socket. We ask you to refrain from smoking, using straws, or spitting too forcefully for 7 days after your surgery. If you are experiencing any of the symptoms I mentioned and it's been approximately 5 to 7 days after your surgery, please contact our office to schedule a follow-up appointment.
Hi, I'm Lexi and I would like to explain the Monojet syringe. Using your Monojet syringe is an important part of your recovery from oral surgery. Please follow the instructions as directed. Begin using your Monojet syringe 5 days after your surgery. Using your syringe prior to that day can cause complications such as dry socket. To use your Monojet syringe, remove the stopper from the syringe and fill the syringe with tap water. Replace the stopper and the curved tip of the syringe into the extraction site of the lower jaw. Depress the stopper, letting the water flow down into the extraction sites. Let the water run out of your mouth and into the sink. Repeat steps 1 to 3, 5 times for each lower extraction site. It is important to irrigate the extraction sites first thing in the morning, after eating, and before going to bed. You will need to follow this routine for 7 days. If you had upper third molar extractions, you do not need to irrigate these extraction sites. Gravity will keep them clean. Here are a few do's and don'ts. Do rest the day of your surgery and the day after, and go half speed on the 3rd day. Do place ice on your jaws for 72 hours as directed. Do use pressure on gauze packs until your bleeding stops. Be sure to change every 30 minutes. Don't smoke, dip, or chew tobacco. Don't use drinking straws. Don't use alcohol or mouthwash. Don't lift, bend, strain, or play sports. All don'ts apply for 7 days after your oral surgery. In most cases, it is not necessary to return for a post-op visit unless a problem arises. If you are in doubt about anything at any time, please contact our office. Thank you for watching this post-op video. We wish you an easy and speedy recovery.